So we've got Gwen from Korebrits. Hopefully I've pronounced that correctly. From Dance Health Alliance. Let's get creative. Cost effectively bringing the science of falls prevention to rural New South Wales through dance.
Thank you. I'm going to have to talk quickly now, aren't I? Oh my goodness. Okay, what age should you stop being creative? Never. Amen to that. I'm Gwen Korebrits. I am CEO and founder of the Dance Health Alliance, and we are a non-for-profit working in the aged care and community health. What I'd like to share today is how that we have taken the science of fall prevention and delivered it in such a way that people actually enjoy. And importantly, they keep doing it, particularly across rural New South Wales. We all know how important fall prevention is, but where things tend to fall down, and no pun intended, is in the doing of it. What we see time and time again is that people don't engage consistently. Programs are hard to keep running across different settings, and in rural areas, access and workforce make it even harder. So for us, the question became, how do we take what we already know works, and how do we deliver it in a different way that's engaging, practical, and sustainable? Something that fits into real-world settings across different levels of care and community. In health, we often talk about upstream and downstream. This is really about strengthening that upstream, preventative approach before people reach that crisis point. This is where Dance Wise and Dance Moves came from. It's a 30-minute or 45-minute therapeutic dance program that brings together fall prevention movements, music, and creativity, and an enjoyable format. It's designed to be adaptable, so it works for people who are seated right through to those who are mobile. And importantly, it's delivered by staff that are already working in the services. So rather than bringing external providers, we are bringing the capacity within the workforce, which makes it more sustainable and scalable. All you need to run a class is a 2-day workshop, some chairs, and a speaker. Over the past 10 years, we have trained more than 1,000 aged care and allied healthcare professionals, and the majority of these work in rural areas. That's been the key, because it means that this program isn't dependent on access to specialists, and it can run consistently regardless of the location. We've also had the opportunity to work really closely with the local health districts, including Western and Murrumbidgee. And their continued engagement demonstrates the sustainability of this program. We are currently expanding this program across other local health districts, including the Mid-North Coast. And here are the outcomes. I'm very excited to share this brand new data, and it comes from our work in Western New South Wales Local Health District, with a great big thanks to Eloise out there. This evaluation comes from a 1-year study of the Dance Moves program, and it shows tangible physical and social outcomes across 8 programs with 119 participants. We have found a significant difference in both the incidence of falls and mobility confidence in the participants, with a 78% reduction in the use of walkers and a 94% reduction in falls over this year. And this data comes from an entirely rural population, where 56% of the participants report living in a very small rural town. So significant improvements were also seen in 3 of 4 of the physical outcome measures, which are common to physios, including the 30-second chair sit to stand. This demonstrates that Dance Mood's program improves strength, endurance, function, and balance. Participants also expressed enjoyment across a range of areas, loving the music, the social aspect of the class, as well as the classes, and enabling them to get strong and active. And equally, the facilitators of the program, who were trained by Dance Health Alliance, also reported loving the music, the opportunity for social connection, the fun, and the mood-lifting nature of the program. So what this really comes down to is quite simply, we don't need to change the science of fall prevention. We just need to think differently about how we deliver it. Because when people enjoy something, they are far more likely to keep doing it. And this creates the incredible outcomes that you've seen here. If we want people to keep moving, sometimes we just have to get just that little bit more creative. Done, my dancers. It's not over yet. All right, my lovely. Beautiful. Let's go. Very nice. Right up. Reach up. Let's go. Let's go. Now, let's see that. See what you like. Oh yeah. Let's go. Walk it along. Alright, let's go. Off the top. Nice. Yeah, this. No, do it. Right or wrong? long as you're moving and smiling and happy. Now anybody else? They're cheeky. All right, answer to power. All right, let's try it. We're almost there. Last time. Here we go. Where's your audience? Yes. So, my friends, it's cost-effective way to keep your residents engaged and happy, and most importantly, creative. So well done.
Thank you very much. We might have time for one question if anyone has one burning question.
How do you feel? Yeah.
Very good.
But do you feel like, can you feel the difference, the shift in your energy and the shift of how your emotions are right now? Like, we change the feeling in a care home. Like, our feedback is that you change the mood of this care home.
Yeah.
And it lasts for the rest of the day.
Well, everyone likes having fun, don't they?
Absolutely.
No matter how old you are.
Yeah.
Thanks very much.
Thank you.
Oh, a quick one.
I have worked with Gwen. I really appreciate this program, but my question is, the choice of music that you put in this program, how much does that also affect their creativity and their connection, their engagement?
Yeah, I think that's the beauty of the program, because we use this over so many different cross sections of people, especially while we're rural as well. You know, there's Aboriginals. We've also trained people that are from Nepal in camps. They're using their own music. Just because I chose that for you today doesn't mean to say that's the music that we use religiously. We use the music that suits the demographic, and the music speaks to the people just as much. So we have, you know, people that haven't heard their cultural music for many years, and then suddenly they hear it. What do they want to do? They want to move. They want to dance. It reminds people of home. So that is the beauty of the program. When we do the training, we train you how to be able to incorporate all different types of music into your movement. Thank you.